Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS 19, and joining me right now, I have Dr. Chris Dennis. He is the Chief Behavioral Health Officer for Landmark Health, and also a provider of care for Teladoc Health. So Chris, good to have you.
Thank you. Thank you for having me.
All right, so this is cool. So you are a psychiatrist.
I am.
And you are somebody who's a provider on the Teladoc Health platform.
Exactly.
All right, so this is cool because we hear a lot about telehealth and virtual care and how the numbers are not as high as people want, but behavioral health is one area where this is growing. Why do you think that is?
Well, telehealth is really the great equalizer in what we do. Behavioral health care is one area that has significant stigma attached to it, as well as issues of access and availability. So when you pair those together, it really leads to one of the growing areas in telehealth.
All right, and so you're actually on the platform delivering care, which is so cool. I don't ever get to talk to doctors, so let me pick your brain. All right, so what's it like? I mean, do you feel like as a provider, as a psychiatrist, when you're talking to somebody, is it less intimate? Is it more intimate? Like, give me a sense of, from your perspective, like as you're doing your job and working with a patient, what do you think?
Right. One of the great things about telehealth is you get to see the patient in their environment. So that may be good, it may not be so great, right?
Let's talk more about that.
Well, sometimes you have patients that are sitting in their bed, so they're bedhead and they're getting right up, but they're able to do it when they can and whenever they can.
Okay.
One of the reasons that it's a great use of telehealth is that when you look at the ability to access it from anywhere at any time, there are patients that are able to go out during their lunch break and go sit in their car and do the interview and do the evaluation. They can go and they can be in their office, they could be in their home. I actually had a patient that was doing the consult from his closet because he didn't want his family to know that he was in care.
Okay, I mean, and that's cool. And what's interesting about hearing you say that, I think to myself, like, wow, are you able to pick up more because of the fact that you're kind of in their personal life, in their personal space when you're coming in on a telehealth consult? I mean, I almost hear, I hear this all the time with folks that talk about voice. Right. So a lot of times they're like, you forget that it's you're talking to the voice application, but it's also listening. And so you pick up a lot of ambient noise. Right. Same here, you're getting ambient noise, you're getting situation, you're getting location. Are you able to kind of discern? Is that actually I don't know, helping you do your job a little bit better?
I think so. One of the things that you see is, for example, is when a patient comes in and their child comes running into the room, if they say, get away, versus hold on a second, what's going on, sweetie, really gives you a different sense of where they are and what they're acting like.
Okay, very cool. Tell me, I guess, a little bit about the patient reaction to it. So have your patients, are they comfortable with it? Because, just the way that we talked about you getting a glimpse into their personal life,
right.
This is me, and you're getting a glimpse into my personal life. My messy closet, my kid running in.
Right.
So what's been the reaction on the other side of the screen?
So, one of the great things is that when you see them in their environment, they really are very open, right? Okay. Many of them, it's the first time they're actually accessing a care provider this way. I had a great example the other day. There was a patient who was a pastor in a local community in a small town in Alabama who, for whatever reason, was driving an hour and a half to go to a psychiatrist because he didn't want to be able to know anybody in his community that he was seeing a psychiatrist. Okay. So he would drive an hour and a half each way to go see a psychiatrist. He found out he had the benefit, was able to then see the psychiatrist through Teladoc Health and also engage in therapy. And because of that, I'm able to see the therapy notes. The therapist is able to see my notes. We're able to communicate back and forth and address his issues holistically.
Okay, now just because I'm not as familiar with the offering from Teladoc Health, so it is not only just the evaluation that you can do, but you can also do your therapy online as well.
Absolutely. There's both therapists as well as providers and psychiatrists to be able to provide prescribers. So I can prescribe medication as well as do therapy. I have patients that I see every 2 weeks, for an hour visit. Yeah. And I also have, it's just like a regular practice. Okay,
I'm going to ask you the obvious burnout question here. So is this helpful with that from a physician standpoint? Because I don't know, or is it so fundamentally different than the way that you were, taught to practice medicine that it's kind of weird? Have you gotten used to it yet? Is it helpful? Really Give me your candid.
Yeah. So, I'm the executive of a national company, and as that, I don't have time to have a private practice and have a brick and mortar, and my wife won't let me go out, on a Sunday morning for 2 hours to go to my office. Right. But I'm able to use my home office during that time and also be able to see patients on nights, weekends. It really allows me to be able to practice.
All right, very cool. And then just last thing from you, I'm just curious. I always like to ask people about kind of the macro trends and things that are happening. And it seems like in the industry right now, obviously there's behavior, the mental health of our country is kind of in crisis right now. Right. And it seems like the industry is just not equipped to handle it. There's just not enough providers. And so solutions like telehealth or virtual care are stepping in to kind of help, bring in, more aid to the people who need it. I guess from your perspective, do you see this kind of crisis in behavioral health care abating anytime soon, or do we have a long way to go? What's your perspective? Give me kind of a glimpse of the future from your perspective as a practitioner.
So again, issues of access and availability are significant in behavioral health, as it is across primary care, et cetera, but more acutely in behavioral health. We see a growth in the industry of telehealth to be able to provide those access to those services. It's really a great equalizer.
What about those apps that kind of help, like texting apps? Do you believe in those too?
Texting apps. I mean, it really, however people access care is really the best way to get them into care, right? And if it's by doing an app and chatting with a therapist, that also works as well.
Awesome. Well, thank you so much for joining us. It's a pleasure to talk to you, kind of pick your brain. I love talking to doctors. So great. Keep up the great work. Thanks so much. I'm Jessica DaMassa with WTF Health here at HIMSS 19. Thanks so much for joining us.